Meds clear, make your concepts clear. Welcome to my channel. Don't forget to like, comment, and subscribe. Let's start with our topic. Causes of atrial fibrillation. Heart consists of 4 chambers. 2 upper chambers, right atrium and left atrium, and 2 lower chambers, right ventricle and left ventricle. Atrial fibrillation happens when abnormal electrical impulses suddenly start firing in the atria. These impulses override the heart's natural pacemaker, which is sinus node, or SA node. It is located in the upper right atrium. Normally SA node fires, and impulses travels through both atrium, as shown through arrows, and causes both the atrias to contract at the same time. And then the impulses travel down to the ventricles and causes ventricular contraction. Whereas, in atrial fibrillation the atria start quivering, means start beating irregularly. Instead of one big impulse, atria start producing small impulses as shown through these small arrows. As a result, on ECG small quivering waves like this is formed, instead of a proper P wave, as atria is contracting without any synchronization, and impulses are not big enough to reach to the ventricle every time atria contracts. Therefore, a regular rhythm is produced in atrial fibrillation. That's why atrial fibrillation rhythm is defined as irregular. Have you wondered what causes the atrial fibrillation? There are many causes that can lead to atrial fibrillation. Just remember this word. Pirates. The diseases that are under the letter P are pulmonary embolism, pulmonary disease, and postoperative. I4. Ischemic heart disease. IV central line. Idiopathic. 4R. Rheumatic valvular disease, including mitral stenosis and mitral regurgitation. 4A. Remember. Anemia. Alcohol. Age. As for T, there is thyroid disease, especially hyperthyroidism. E for elevated blood pressure. Electrocution. Lastly S4. Sleep apnea. Surgery. Sepsis.